All right, in other news, South Africans are marking World AIDS Day with renewed calls to step up the fight against HIV. This year's national commemoration is being held in Ga-Masemola in Limpopo, where Deputy President Paul Mashatile is expected to address the World AIDS Day from Sekhukhune District. Mashatile is expected to speak on the progress that the country has made in the fight against the spread of HIV and TB, while also highlighting the work that still needs to be done. Watching this big story for us is SABC News reporter Koketso Motau, who joins us now live from Ga-Masemola in Limpopo. And Koketso, I imagine one of the issues that Deputy President cannot avoid is the funding cuts that South Africa, amongst many other countries, have suffered during the Trump administration.
Well, most certainly, Ayanda, good morning to you and good morning to the viewers. Indeed, the funding cuts is really going to affect the programs that are actually in place to fight against the spread of HIV and TB. But I want to speak more about these issues with the DGG in the Department of Health responsible for HIV and AIDS, Dr. Fikile Nkobu. Thank you so much for joining us here on SABC News. Let's talk about the funding cuts. How is this really going to affect, the fight against HIV and AIDS?
We had the funding cuts that came to us in February this year, and it had a real major impact, particularly in the community and at the primary healthcare level, where most of the support was coming from. But we quickly regrouped as a country, and the department put a funding proposal to the National Treasury, and we were able to get 750 million rand, which has gone in. The money has been distributed to the provinces, and the provinces are meant to try and fill in the gap that came through that. We also had the money being directed to research, which was another major area that was affected. Importantly, we also directed some of our money into our community-based organizations, which we were already funding, so we had to put in a bit more money in terms of that so that we could plug in from the community. Obviously, the amount of money is not enough, and it's not going to be enough. But there's also some other funding that comes in as a system strengthening, the adjustment phase that has been just announced, over 6 billion rand, which also plug in the system, because we must also understand it's more the system, the health system, that must be strengthened so that it carries the burden of the HIV and TB. So that is what has been done thus far.
Let's talk about this close gap, campaign that you launched in February this year, and your deadline is actually the 31st of December. So already December. So how far are you in terms of tracing those people, the 1.1 million people who are HIV positive, but they are not on treatment?
Thank you very much. I think this is one area where we've really made a lot of progress, and the minister will be announcing where we are exactly. But what we see is that whilst we are finding them, and we may meet the 1.1 million, but the same is a high number of people are dropping out at the same time. So we find them, we get them back into the system, they drop out of the system. So it's one area where we need our communities and the private sector and the community organization and the media yourselves to assist us to say, we are bringing you back to keep you, not to drop again. So we've made progress, but I think we are also clear that we are dropping. A lot of our people are coming into the system and leaving it. And the issue of adherence is important. We are again working with the civil society and organizations in particular to look at adherence programs that would assist us to keep people on treatment. But also the launch of the 6 MMD, the 6 monthly supply, is supposed to assist us to say those who are well adherent, let's not bring them into the system so that the system can be free to keep the ones that we need to take care of.
We see the new HIV infections rising, particularly among young girls and young women. What measures are in place to ensure that perhaps you get to reduce the infections, and how is the learner care pathway going to assist in terms of closing this gap?
I think the young people are one area that has been quite difficult. We did see the decline, by the way, so it's not that it hasn't, but it hasn't been a decline that is making the kind of progress that we want to see. And obviously the programs around prevention that we work with, look at the higher education, the higher health is part of our partners, the civil society organizations, the youth organizations. We work with Soul City, we work with Life, we work with community-based organizations through SANAC as well. We also have young people who've come out with AI tools, that electronic tools that are going to be assisting us. So all those innovations we are putting together for our young people to ensure that we bring that infection down. But also, what is important is what we are raising and saying, what happens with the lenacapavir. Lenacapavir, the adolescent and young women are part, together with the key populations that we've prioritized in the few doses. There are over 900,000 doses that we will be getting so that they can be. Oral PrEP is still there, condoms are still there, sexual and reproductive health education is still there in our clinics, and we talk about not just our clinics, also in our communities, also in the community-based structures. So those are all the programs that we are looking at. We will be rolling out the lenacapavir starting from the 1st of April next year, the long-acting drug, 6-monthly injectable, which will form part of the combination prevention. We are not looking at it all alone. Condoms are still important. Oral contraceptions are still important. We really want to stress that. Thank you.
Just in conclusion, let's talk about the measures in place to encourage those who are actually HIV positive to come through and also get this treatment.
We are calling out on everybody who's out there. If you have been diagnosed with HIV and we started on treatment, please come forward, come back into the system. We're also talking to our facilities to say they must welcome people. We are monitoring that so that when people come into the facilities, they don't find challenges. We also have the out-based teams that are going out and finding people. We know that there are people who are finding. We are seeing, though, advanced diseases, which means it's people with low CD4 counts, viral loads that are sitting, and that we are calling to come back into our facilities, come back into the system, even in our mobile sites, so that they can receive the treatment. We are encouraging families, let's look and support each other, because they need a lot of support in terms of taking long-term treatment, and we understand that. So it's all of us with really being supportive and ensuring that they are supported to come out, and no stigma out there. Let's protect them, let's support them.
Well, Dr. Fikile Ndlovu, thank you so much for talking to us here on SABC News. That is the DDG responsible for HIV and AIDS at the Department of Health. And Ayanda, I can tell you that indeed we are expecting the Deputy President to give that message of support as part of commemoration for World AIDS Day here in Ga-Masemola. He's expected to take to the podium around 12:40, and will be continuing to give you the latest in terms of what is happening here in Ga-Masemola. But for now, let's just get back to you in studio.
Motau, live to us there from Limpopo. Thanks very much indeed.